Have you heard about the latest findings on apnea of prematurity?
Yeah,
It's really intriguing how such a common issue in preterm infants has so many layers.
absolutely. I was just reading about how their immature respiratory systems contribute to it. Can you explain more about that?
Sure, it's like their brains aren't fully developed to control breathing yet.
Right.
So they experience these pauses in breathing, which we call apnea.
And this is mainly due to central nervous system immaturity?
Exactly.
I see.
But what's fascinating is how their responses to low oxygen and high carbon dioxide levels are different.
Wait, can you elaborate on that?
Well, when oxygen levels drop, instead of increasing their breathing, preemies might actually slow down. It's called hypoxic ventilatory depression.
So their bodies aren't reacting the way we'd expect.
Precisely. And
Yeah.
during REM sleep, they have even more irregular breathing patterns.
That makes sense since sleep affects breathing in general.
Right, so treatments often focus on supporting their airways.
Mhm.
We use things like prone positioning and CPAP to help keep them open.
And I've heard caffeine therapy is common too?
Yes, it's fascinating that caffeine, the stuff in coffee, helps stimulate their breathing. It enhances
No way.
respiratory muscle function and central nervous system activity.
But aren't there concerns about giving caffeine to such tiny infants?
Well, studies have shown it's safe at proper doses. In fact, it
Good
can
to know.
reduce risks of complications like bronchopulmonary dysplasia.
That's impressive. Are there other therapies being considered?
There are, but their effectiveness isn't fully established yet.
Okay.
For example, kangaroo care has benefits, but its impact on apnea is still debated.
Speaking of debates, what about the role of gastroesophageal reflux in apnea?
Well, that's a controversial topic. Some believe there's a connection, but recent evidence suggests the link isn't strong. So
Really?
treating reflux might not reduce apnea episodes.
I'm not entirely convinced. I've seen cases where addressing reflux seemed to help.
That's a fair point. Perhaps
Yeah.
in certain cases there's a relationship, but overall, the data doesn't support it universally.
I suppose more research is needed then.
Definitely. And that's true for other therapies too, like CO2 inhalation or red blood cell transfusions.
Mhm.
Their roles in treating apnea are still being explored.
What about the long-term outcomes? Does apnea impact neurodevelopment?
That's still under study. Some research suggests severe, recurrent apnea could have negative effects. But isolating apnea from other factors is challenging.
I see.
So it's a complex issue.
Indeed. It seems we have more questions than answers at this point.
Exactly. But understanding these challenges helps us improve care for these vulnerable infants.
Absolutely.
Every new piece of research counts.
You mentioned genetics earlier. Are there genetic factors involved in AOP?
Yes, actually, studies have shown high heritability among twins.
Interesting.
So genetics may play a significant role in susceptibility.
That's something worth investigating further.